Hi, everybody. Sorry, I'm just expanding my second screen so I can see all your names and or lovely faces. How are you all? It's nice to see you on a really rainy Chicago morning. So today I'm going to talk to you about some projects that are happening on the Maywood campus, our health sciences campus of Loyola. By way of introduction, I'm a professor in the Department of Public Health Sciences. My background is I'm a nutritionist by training. And so I've been teaching public health for quite a long time. I've been at Loyola for the last 27 years, primarily doing research, both locally as well as internationally. So we're going to get started. We're going to talk a little bit about COVID today, and we're going to talk about COVID as it's existing in our communities of color. And just sort of to orient us, we're not going to be talking much about or at all about the city of Chicago, but rather the suburban Cook County communities in which Loyola's Health Sciences campus is located. Unfortunately, as we've been seeing in the news, sorry about that, COVID cases are ticking upward across the United States. And I believe yesterday there were 60,000+ new cases of COVID-19 recorded in the United States. And those are confirmed cases. And as we know back, this is an NPR story from June, and it became fairly obvious early in our pandemic that the communities that were being hit the hardest, and in Chicago, it was absolutely striking, were communities of color. By early June, over 70% of the deaths from COVID-19 in the city of Chicago were centered in Black communities. So these are some statistics as of yesterday from the state of Illinois.
Amy,
so
I'm going to interrupt. We're not able to see your screen.
I thought that is not good.
There we go.
I apologize. Well, let's go back. I apologize for that completely, folks. I wish you'd spoken up earlier, David.
You know me, I'm slow.
Okay, so anyway, that's the first picture. Okay, and then this is a next one, and then this is the last one, NPR. And now here, now we're all good. Is that right? Okay, sorry about that, folks. I only do this on a daily basis in classes. You'd think I'd have it down by now, but all right. So in Illinois, we have over 360,000 cases of COVID-19 as of yesterday, and with the recognition that there's probably a 7-day lag on the data reporting. As you can see here, of the reported cases, about 14 to 17% are amongst Black identified populations, over about 30% or so amongst whites, and at least a quarter or so amongst Hispanic Latinx populations. And of course, you can see here there's a huge proportion, over 25%, that are there's no race ethnicity identified. And that was really early in the epidemic. A lot of data were coming in without identification. What we do know is of amongst the deaths, we have a disproportionately high representation amongst Black populations. The state of Illinois has about 14% African-American or Black residents, and yet amongst our deaths that we can that have been confirmed due to COVID-19, it's about 25% of the deaths have been recorded amongst Black populations. And of course, this is all made questionable because we don't know about that big blank unidentified group. So we don't want to take that as a rock solid estimate, but it's an indication that there's probably some health and racial ethnic disparities amongst both people being affected by COVID as well as deaths amongst COVID populations. The case fatality rate in Illinois is about 2.6%. So that means about of the people who contract COVID-19, about 2.6% of those individuals go on to die. And that's pretty comparable to the national estimate right now, which is around 2.7%. For reference, flu, our annual flu, it's less than 1%. So if individuals tell you, oh, it's just like the flu, and in fact, it's not just like the flu. It's much, much more deadly. So if we shift away from Illinois as a whole and we start taking a closer look at Cook County Department of Public Health data, this actually mirrors the pictures we've seen for the United States as a whole. It mirrors the situation for Illinois. So we call this an epidemic curve. So it plots the number of cases on a daily basis, and you can watch the trends as they go up. We hope down, but right now we're still on an upward trajectory, or a new upward trajectory, I would say. So as of yesterday, there were almost 71,000 cases of COVID in the suburban Cook County region. So so we're all sort of oriented. The Cook County Department of Public Health, their area of coverage is all of suburban Cook County, except Oak Park, Evanston, Skokie, and Stickney townships, which have their own departments of health. So just to keep that in perspective. So we are seeing a spike in our communities. And so what I'm going to focus on today is a subset of our communities in Cook County. And these are communities in Western Cook. And these are 5 of the communities we'll be talking about are covered by the Loyola University Health System, LUHS. And in these 5 Black and brown communities, 17% of all cases of COVID-19 in suburban Cook County have been recorded. And yet the population in these 5 communities only represents about 8% of the total population covered by CCDPH. So there's a fairly significant discrepancy here. And you can see by this map of Cook County that the communities in the red circle, which is where we'll be, just to orient you, it's if you head due west on 290, you go through all of these communities. So, and we're going to talk in more detail about what those communities are right now. So these are cumulative case counts. In other words, all of the cases that have been recorded in each of these communities since the beginning, since the middle of March, as of yesterday. And again, there is a bit of a lag, a 7-day lag, reporting lag. So we have the case counts, which are the number of individuals who've become ill or have tested positive, and compare that to the case rate, which is normalizing the data per 100,000 residents. So the 5 communities that are sort of highlighted in beige are the ones we're going to be talking about predominantly today. So Maywood, which is where the Health Sciences campus is located, Bellwood, which is a predominantly African-American community to the west of Maywood. Maywood itself is a largely Black African-American community. Melrose Park, which is just to the north of us, which is very Latinx, as are Cicero and Berwyn. And then I've put in here, for sort of comparative purposes, communities that neighbor our communities. And those are Forest Park, Oak Park, and River Forest, which have much lower rates of populations of color. In fact, River Forest is about 85% white. So you can see there's a stark disparity, particularly, you know, for comparison purposes, you really want to look at the case rate. So Melrose Park, Cicero, and Berwyn are communities of largely Hispanic and Latinx residents, have extraordinarily high rates. Melrose Park has had the highest case rate of COVID-19 for the last several months. And Bellwood, early in the pandemic, Bellwood actually led suburban Cook County. Now, these are not comparable necessarily to the city, because the city and different neighborhoods in the city have really experienced dramatic racial and ethnic differences as well. So what I hope to talk a little bit today about is why do these differences in COVID-19 rates exist between communities that are really neighboring? And so I'm going to focus this on the social determinants of health. And we're going to use one of these communities as sort of a case study. And then we're going to talk about what we're doing out here, not just in Maywood, but at multiple schools at Loyola to sort of address what's going on. So the social determinants of health are really the catchphrase of the last 10 years or so. So these describe those conditions in which people are born, grow, live, work, and age. They are shaped by the distribution of money, power, resources at a global, national, and local level. The social determinants of health are mostly responsible for health inequities, which is the unfair and avoidable difference in health status seen between and within countries or communities, as we'll talk about today. So in the case study we'll look at, which is Maywood, you'll see that these different individual domains of the social determinants of health are sort of posted on the screen, so you can orient yourself to why this particular piece that I'm talking about is related to social determinants of health. So economic stability, healthcare, social and community context, education, and the neighborhood and environment. So sort of to orient us and to also point out the communities that are neighboring Maywood. So the red star is where the Loyola University the Health Sciences campus is. It includes the School of Medicine, Parkinson School of Health Sciences and Public Health, the nursing school, Niehoff School of Nursing, as well as Loyola University Medical Center, which is not associated fiscally any longer with the university. Just so we're clear, we're two separate fiscal entities, but we do work closely together. So Maywood is separated from this community called River Forest and Forest Park by a river. So this is the Des Plaines River. And I point that out so that later when on one slide in particular, you can get my point of comparison. Melrose Park is here, Bellwood is here, Berwyn is down to the right, lower right, and then Cicero obviously is to the east of Berwyn. So these are all very close communities with very distinct racial and ethnic makeup, as well as age distribution differences, etc. So Dr. Diana Hack-Barth is she just retired actually, but she was a faculty member in the School of Nursing for ages. And I just remember being at meeting after meeting after meeting, and she made this comment over and over and over again. There have never been sidewalks between Loyola and Maywood. So just that's both in the literal sense, but also in the figurative sense. And I feel that we're beginning to build those sidewalks. So I'm going to give you, as our case study, a very short history of Maywood. And in the interest of transparency, I live in Maywood. I've lived in Maywood for the last 20 years. I've been at Loyola that long. And it's a place that I'm very happy to live in. I love this community, but there are challenges, and that's what we'll talk about in the next several slides. So prior to there being a community of Maywood or a town of Maywood, it was a stop on the Underground Railroad. It was called the 10 Mile Freedom House, which so when people escaping bondage in the South, they were able to know that they were 10 miles outside the city of Chicago. Now, this is on the river, on the Des Plaines River, right at Lake Street. There's a McDonald's there now, but there also is now a nice little memorial to this really critically important part of our history. So Maywood was founded right after the Civil War by 4 officers of the Union Army. The primary founder was this Colonel Nichols. So one of the unique features about Maywood is that it was integrated from its establishment. It was the only suburb in the entire Midwest and one of extremely few across the country in the late 1800s that actually allowed African Americans and Jewish people to own property, to be able to own their own homes. It was absolutely unheard of. So Maywood has a very long history of being an integrated community. Did that mean segregation didn't happen? No, not exactly. But it allowed ownership and people to build their lives, their businesses, their churches, etc., in an integrated community. It was an incredibly prosperous community in the late 1800s and the first half of the 20th century. We were one of the first suburbs to have electric trams. We had electric lights. We had Sears Roebuck. We had a Montgomery Ward. We had car dealerships. There's rumors we had a very robust retail community. Rumors that we had 3 movie theaters at one point in town. I will tell you, none of that exists today. And the reason it existed was because we were on the railroad. So we were one of the first bedroom communities, if you will, for commuters to the city. But also it was an industrial spot that we had factories built along the railroad. And so that railroad really facilitated things. It was a good place to live. So this was an advertisement from the 1920s. I will say that the 2 photographs in the slide were taken just recently in a 3-minute walk around my neighborhood. So in the 50s and 60s, just like most urban settings across the United States, white flight began to occur as white individuals moved out of urban settings and moved into for better life in the suburbs. Well, Maywood also experienced significant white flight. And in the 1960s, Proviso High School was one of the first schools in the country to actually experience race riots. And Maywood is the hometown of Freddie Hampton, or Fred Hampton, who was the Chicago leader of the Black Panthers and who was murdered by Chicago City Police and Cook County Sheriff's Office when he was 21 years old. So we have a long, rich history. It was not always smooth, and it was not always problem-free, but it was a wealthy community. I have a good friend who says her family moved to Maywood in the 1960s from the city, and it really was viewed as a destination for Chicago Black families. And yet even she says, well, you know, that was the school we could go to, or we were allowed in Maywood even, that this was the grocery store that we could go to. So even in a community that had always been seen as integrated to some extent, there was still significant segregation. And so with the white flight, disinvestment in Maywood really picked up. Those retail businesses left. And in 1972, the largest, and by that time, one of the only employers in the community, the American Can Company, closed down. So the American Can Company in Maywood was the largest tin can manufacturer for decades and decades. And during the World War II, as many of the Maywood men went off to war, more women and more African Americans were hired at American Can. And that really sort of improved economic situation for a lot of families, but it also hastened the white flight from Maywood. And so by the time American Can closed down in 1972, economic investment was pretty much nil. And in fact, disinvestment was more common than anything else. So I actually went back and pulled up census data as far as I could, and not everything is electronic these days. If you go back, you had to dig through some photocopies of old census materials. But this is kind of a rough illustration of the change in the demographic makeup of Maywood between 1930 and 2010, our last census. And I will tell you, our census now, in 2010, we only captured about 69% of the population in Maywood, and it's even worse this year. So we're not exactly sure of the exact racial and ethnic breakdown in the community, but this probably is a fairly good illustration of the trends over time. So this economic disinvestment is one piece, I think, of what communities like Maywood are facing, which is structural racism. We've all been faced with issues dealing with racism over the past summer. Communities and individuals like Maywood and people who live in Maywood, it's obviously a permanent feature. So again, structural racism is not something that people or institutions choose to practice. As it says here, it has been a feature of the social, economic, and political systems in which we all exist. And I would argue that structural racism is one of the, is an overarching piece that is driving communities like Maywood to actually be unable to build back up from that economic disinvestment that was observed between the 50s and 70s. And I'm going to go through a couple of examples of this. For those of you who own property in Cook County, 3 years ago, there was a huge expose by the Chicago Tribune about a practice called regressivity, which in the tax property assessor's office, it was a concerted practice. It was to overvalue homes in low-income communities and undervalue or undervalue homes in high-income communities. And it was purely political in nature, knowing that individuals in high-income communities contribute to political campaigns, etc. It was a well-established practice in tax assessor's office, Joe Barrios, and it actually was a leading factor for why he was voted out as tax assessor for Cook County. That said, our new tax assessment just came this couple weeks ago, and my house has been reassessed. This is my home in Maywood. My house has been reassessed at 30% higher than it was last year. So you have the assessment of how much your property is worth, and then you have the tax rate in that community itself. So these data are from 2017 from the tax assessor's not the tax assessor's office. I can't remember where I got them now. It's from the website. Maybe it was the tax assessor's office. They're 3 years old, but it's ranking the property tax rate in all of the communities in Cook County. So the 10 rates you see here, thankfully, are the highest rates of all 130 or so communities in Cook County, and the bottom two are the two lowest rates. What do those 10 towns have in common? Anyone? These are all communities of color, predominantly African American, every single one. At the bottom, we have Chicago and Oak Brook. And if any of you live in Chicago, you know the uproar that is made when property taxes are increased by 0.1%. So as someone who lives in Maywood, I don't have a lot of sympathy. I'll be perfectly honest. So my house is a lovely house. I love my house. Last year, and I live in Maywood, last year we paid $11,000 in property tax. Next year with our new assessment, we'll be paying $13,500 per year in property taxes. And you would say, well, that's okay, because, and I'm all for taxes. I have no problem at all. Property taxes are needed to support communities. Property taxes are needed to pay for schools, enhance roads, pay for police protection, etc. So unfortunately, Maywood does not suffer or benefit dramatically from our astonishingly high property taxes. And as you might guess, those levels of property tax, it's a vicious cycle. People will not come in, businesses will not come in because of the high tax rates. So it's sort of this, it's a cyclical piece. Our taxes are so high because we don't have businesses, we don't have the commercial property taxes to offset residential. But property, you know, commercial and retail are not going to come in because the property taxes are so high. So it's a truly vicious cycle. And we have some of the lowest performing schools in the state of Illinois, actually. We don't have a business district any longer. Our parks district is minimally active, though that is improving. So we have some challenges ahead of us. And another piece of structural racism, and I think this is very clear, is that up to the Depression or the Great Recession, if you will, of 2008, Maywood, because of our low income residents, we were subject to dramatic predatory lending practices. 1 in 4 houses in Maywood, you know, just think about this, on your block, 1 in 4 houses in Maywood went into foreclosure between 2006 and 2017. 1 in 4. That really damages community cohesiveness and social cohesion among neighbors. And I will say in Maywood, it's mostly single family homes. These are long-standing families, long-standing family homes. And just sort of to put the nail in the economic piece of Maywood is we have the 3rd highest water rate in all of Cook County. And so this was a story again from 3 years ago. 3 years ago there was some really good investigative reporting done by Chicago Tribune reporters about the cutoff rate. Actually, I should have put in last 2 weeks ago or 3 weeks ago, something like 1,000 water shutoff notices just got sent out to Maywood residents. So that is a huge burden for cost-burdened households to begin with. And unfortunately, Maywood does suffer from a violence situation, which is all tied into the social and economic conditions in the community. And we, you know, at Loyola on the health sciences campus, we like to think that our hospital provides great community access and is, you know, we're the part of the community, when in fact, most community residents went to Westlake Hospital, which was bought by this was last year. So about a year and a half, it was purchased by one of these large healthcare systems, and within 2 weeks of purchase, they shut down the primary healthcare provider in our community and in Melrose Park, just to the north. And sort of to finish it up, Maywood has had historically fairly high food insecurity rates. And these data come from pre-COVID situation. And I know Dr. Koba is on here and she's leading a group to get through called VeggieRx, where foods are delivered to or distributed amongst our food insecure residents. And then I'm just gonna throw these out here. Let me just remind you, I really love living in Maywood. I'm just pointing out some of the challenges that our community faces. And we'll tie this back to COVID in just a moment. So as you can see here, Maywood on pretty much all the demographics in our health indicators around women's health and reproductive health, we are not doing well relative to the rest of suburban Cook County. Over 50% of our households are considered cost burden households, which means the housing costs are more than 30% of the total household income. So we are a challenged community. And then just to sort of put nails in the coffin, if you will, and I'm sorry, that was a very poor joke or pun. We're going to look at some of the health impact, the health needs data that came out of our university, the health systems health needs assessment a few years ago. Taking a look at both sort of, if you took a wedge out from the city, from the loop, this health needs assessment covers part of the city as well as these western suburbs. And so you can see in this wedge, Maywood comes up with the highest unemployment rates, and 3 of the communities that we'll be talking about with our CERCL group are under the highest poverty rates, as defined as 200% of the federal poverty level. Maywood has extremely in the highest quartile of heart disease mortality, stroke mortality, and diabetes related hospitalization. And I bring these up because these are really significant risk factors for negative outcomes for COVID infection. So we know that people who have comorbidities also have much worse health outcomes and have much higher rates of death from COVID infection. And then finally, just to bring it home, again, we're separated by a river from River Forest, the Des Plaines River. So if you cross east to west on the Chicago Avenue over the Des Plaines River, your life expectancy drops by 9 years. To me, that's surreal. And it shows we have a lot of work to do. And now I am just going to, this is obviously not suburban Cook County, this is obviously the city. And I would just like to sort of point out that nothing happens in isolation. You know, here, this really was an illustration of gun violence and homicide, but it's totally linked to income. It's totally linked to race. And now we have a new epidemic that we can pretty much layer right on these maps right on top of each other, showing that we have a lot of work to do as a society to improve health equity across all of our populations. So into this pre-existing milieu of health and social inequity, along comes COVID-19 and the statewide stay-at-home order. So I'm going to go through a brief history of the COVID Equity Response Collaborative, Loyola. Much easier to say CERCL. So if that's, when you hear me say CERCL, that's what I mean. And I see that Maya Watson has joined, and Maya is part of our CERCL collaborative. She's working with the Health Justice Project at the law school now. So in March, our governor signs a stay-at-home order. And I have to tell you, as a public health person, and I think a lot of people in our department were feeling very anxious during this time. We were at home. There was not a lot we could do. We were feeling underutilized and very anxious, as I think most people were during this time. One of our village trustees called me on April 13th and said, or asked, is Loyola doing community level testing for COVID-19? Because we know that there's higher rates amongst communities of color, and Majority Senate Leader Kim Lightford, who lives in Maywood, is interested in knowing whether Loyola, or whether there was an FQHC or federally qualified health center that was providing free testing to the community, or 2, if Loyola University Health System was offering community level testing. And the answer was a solid no. no to either of those. So at that point, there was no avenue for people to get tested, even if they were sick, at Loyola, unless they drove to Burr Ridge. Now, some of you probably, which is where we have an outpatient center. So probably, maybe many of you city folks don't know about Burr Ridge, but Burr Ridge is a very wealthy community to the slightly southwest of Maywood. So we would expect our patients, and again, it was only patients, so there was no community testing at all. We would expect the patients from LUHS to drive or somehow take public transportation, being sick, because at that point in time, only ill people were being tested at either, I do exaggerate. So it was either Burr Ridge or Oak Brook, which is essentially the same demographics as Burr Ridge. So basically there was no testing within our boundaries or in Bellwood. So that really prompted a gathering of minds. I called the health system, I called the community benefits at the health system. I got connected with doctors who had working with medical students who'd set up a hotline for community members at the hospital. I had staff members in our department who were anxious to do something. Again, we're public health people and we're feeling completely hamstrung. So this became a few people having meetings to a much larger group. And so CERCL at this point, and let's see, is comprised of nursing faculty, medical faculty, public health faculty, students from those 3 schools, staff from those 3 schools, as well as undergraduate health care administration students. We have lawyers and law students from the law school, social work students working together. And we're going to walk through sort of the structure of CERCL, as well as how it came about, but the structure and the reason we're taking the approaches we are. So CERCL requested Health EQ funding, which is an internal Loyola health equity fund that was set up after our last strategic plan. We received enough funding to launch a contact tracing training program and to support COVID-19 testing in the communities. So that was in July. Believe me, we were meeting routinely, reaching out to everybody you could think of. We tried to get Walgreens and CVS to support testing in the communities because we heard they were doing it in the city. No go. We reached out to sports stars who were from Maywood. Surprisingly or not, there are a lot of basketball players, famous basketball players, who were born and raised in Maywood. And in fact, we have one now who has expressed a great deal of interest in supporting CERCL. We called Illinois Department of Public Health, Cook County Department of Public Health, Chicago Department of Public Health, McCain Department of Health, McHenry County of Health, Kane Department of Health. We created this incredible web. We documented every single testing place that anyone in our community could go to. There are none in our community, but we really reached out and created this incredibly broad network of people. And then we got the funding and it was like, okay, now it's time to go. By the time we got the funding in early July, our contact tracing training program was already well established. Abigail Silva, who is running our research project now, set up this training program. It's a free training program. It builds off very well-established training programs already existing. And I believe Dr. Koba went through the training as well. It teaches soft skills. The issue is we can't do contact tracing in the community on our own. This really has to be linked to the health department. And what we've found is the Cook County Department of Public Health is completely overwhelmed. They're understaffed, they're overwhelmed, and they have not been, they've been receptive to discussing issues, but we've not really been able to make a strong connection with CCDPH. That said, we have placed some of our trainees with Chicago Department of Public Health and other departments in the collar counties. Unfortunately, not in the community, not in the county that we want to work in most closely. So we began free community-wide testing in Maywood at the end of July. Maywood and Melrose Park, two of our local communities. We were offering once a week free testing. Anyone could walk up for 8 weeks in July and August, well, August and September. And then we submitted a funding request to the Walder Foundation. And we'll get to that grant next. We received the Walder Foundation grant. And we're going to talk about that program in just a minute. And so we did, I said, we almost did once a week testing in each of Maywood and Melrose. And now we're in the phase, we're going to be expanding our testing to those 5 communities of color that are hardest hit in our communities, in our sort of service area of the health sciences campus. So we based CERCL on this classic public health approach to epidemics: test, trace, support, and isolate. You have to have all 3. As we've seen at a national level, we have not done this well in many places. New York has done quite well following the initial onslaught. We've had difficulty getting tests. We've had difficulty, which is, sort of hard to believe. Early on, we had major problems, even getting the test tubes and the swabs. It's hard to believe, but the swabs were a big thing. How can that be in a major manufacturing country that we could not produce enough swabs to do the tests? So there were, and PPE, personal protective equipment, was extremely difficult to find early on. So our staff and our students scrounged they looked under every rock they could to find us access, preferably donated, but find us access prior to our funding, find us access to any of this stuff. And as I said, we got the tracing training program done really early and underway, and it's still training people. If you're interested in being trained as a contact tracer, we can definitely send you that information. And then we started our testing. So this classic approach, you need surveillance. You need to know who has been in contact with positive cases, and then you need to encourage self-isolation and quarantine. And what has become a critically important piece of CERCL is the support to the families that have been impacted. We're talking about multi-generational families living in the same home when multiple breadwinners, multiple earners cannot go to work because there are positive cases in the home. So we're facing huge degree of food insecurity, a fear of housing loss, no access to appropriate healthcare. And that's where Maya Watson, Kate Mitchell, and the Health Justice Project have stepped in collaboration with the School of Social Work and social work students to support, to screen for these needs and to provide resources and referrals. So our approach is multidisciplinary, it's collaborative network. We have multiple community, I should have mentioned this, we have multiple community partners. We couldn't do this without the buy-in from community-based organizations. We have public and governmental partners. And so our goal is to work for health justice that have been most impacted by structural inequities. So our 4 essential actions here, again, are testing, tracing, which is finding here, and quarantining or isolation for affected people. So right now, we're trying to ensure that our 5 Black and Brown communities have access to COVID-19 testing, are involved in contact tracing from the ground up, and are quickly connected to resources to isolate and support. These are the current positivity rates published by the state of Illinois. And I will say we have a little bit different metrics, a little few different numbers from our testing, and I'll show that at the end. But as you can see, in all of, and this was about 2 weeks ago, it's probably gone up now across the board. So positivity rates are not this, they're confirmed cases, but it's a snapshot in time, right? So we have, in suburban Cook County, we have 6% of people who've been tested positive. These again are state of Illinois data. You can see in Maywood and Bellwood, we're slightly about 50% higher than the county levels, but Cicero, Melrose, and Berwyn, Cicero and Melrose Park are exceptionally high, 2 and 2.5 times the rate seen in the rest of suburban Cook County. So, and among our accomplishments to date, we conducted 671 free COVID tests, and I will say they were free to the participants. They were not free to us. We paid for them. We paid Loyola University Health System to run these tests in their labs, but they did give us a very discounted rate, thank goodness. Otherwise, we could have only done a fraction of these. We've trained more than 65 students and community members on contact tracing and shared more than 15 job opportunities. And we've screened over 300 community members for social and legal needs. And I will tell you, if you go on the Illinois Department of Public Health website and look for testing sites, you can do it by community. We are the only site listed for Maywood. So think about this, a volunteer organization of collaboration of, I won't say random people, but seemingly random people are the best that the state of Illinois can do for the community of Maywood. Bellwood doesn't have anything. Melrose Park actually has 2 sites listed today. One is us, CERCL, and the other one is FQHC, the PCC clinic in Melrose Park. To me, that says there's something terribly wrong at the state level and at the county level. And of course, we have many, 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 many partners pretty much across the university. We've really tapped into lots of expertise. Every group, every school has contributed expertise, people, manpower, et cetera. And then we have multiple community partners as well, and governmental partners. So our current initiative through the NetWALDER Foundation, we received a very large grant. To be honest with you, we were one of 8 awarded by this family foundation, which is centered in the city of Chicago, or maybe Skokie actually. But we are the only one outside of the city of Chicago. So CERCL is the only group looking at this situation, the COVID-19 situation outside of Chicago. And their focus really was on establishing a network so that we can predict the next pandemic. So in other words, stockpiling, if you will, samples from people who get tested with appropriate ethics clearance and approval, so that our lab scientists can then monitor those samples to see what, unfortunately, there probably will be a next pandemic. So the purpose of this for our application was to address key public health questions related to the transmission of the SARS-CoV-2 virus in the greater Chicago region, to provide actionable data for public health decision-making, both during the pandemic, and then to provide an early warning platform that would rely on ongoing research, including the collection of community samples. So we have been funded to test 6,000 individuals and refer them for treatment as needed in these 5 communities, as I mentioned: Bellwood, Berwyn, Cicero, Maywood, and Melrose Park. So there'll be multiple levels of that people who come in to be tested can agree to. One is just a consent, a de-identified consent to store their samples, completely de-identified. No personal health information or protected health information would be shared at all. And this, it just stored in the freezer for future analysis. And this would be the biobanking of the nasopharyngeal samples for emerging pathogen surveillance. What we hope to get is most people to agree to take a questionnaire so that we can understand. It's a very simple social network analysis, so we can understand, not naming names of people you know, but sort of your general contacts. You know, how many people do you come in touch with at work? How many of those do you know have become ill? How many people at school? How many people live in your home? Etc., along with basic epidemiologic analyses, as well as assessing practices around prevention of transmission. You know, do you wear a mask? Do you wash your hands frequently? Do you practice social distancing, etc.? And then the third level is that if people want to consent to a separate study to have multiple serial blood draws to monitor the appearance or the existence of antibodies. So once you get exposed and you have COVID-19, even if you're asymptomatic, right now, what we know is that people develop antibodies to the pathogen. What is unclear in the purpose of this study is to follow people longitudinally to see how long that antibody response is robust enough, hopefully, to confer immunity. Right now, we don't know much about long-term immunity status of people who've tested positive. So why are we doing this? Again, this is basic epidemiologic response to epidemics, public health response. We're bringing resources to our community, even if it's funded as a research project. This is from some of our testing over the summer. It was really hot out there some of those days. It was incredibly hot, but we're moving inside. So so that right now we're in the process of identifying indoor sites, and I think we have four of the 5 nailed down, and we should start our testing again very shortly. We also want to provide opportunities for our communities of color to be part of research. It's very well known that Black and Brown communities have historically been not part of research for a whole host of reasons, for both sides of the equation. And so we want to provide the opportunity to be part of research, but in a way that provides them positive information and can be completely anonymous. And then also we're hoping to co-develop with our community organizations an infrastructure to help keep our community safe and healthy by creating a stronger network amongst multiple government entities. We're involved with the Village of Maywood, the City of Cicero, Department of Health, City of Berwyn, et cetera, along with community-based organizations and an academic institution, that hopefully we can set up this network to keep moving forward in addressing some of those other issues around health and equity. And this is just, it's not even a full list, as hard as it is to believe, but we have, again, Abigail Silva. Dr. Silva is our project lead for this. We have people from the community, we have social epidemiologists, basic lab scientists, lawyers. I forgot to put you on here, Maya, I apologize. These are slides courtesy of Abigail Silva. And so it definitely takes a village. It takes a huge network, and it's hard to overstate the amount of work that volunteers have put in. And I mean, faculty, staff, student, and community volunteers have put in to get us to this point. So these are our data from our CERCL testing. So Maywood and Bellwood again. So I did this last night as an exercise in our undergraduate public health class, and I'm almost done. There's only a couple more slides, don't worry. I gave them the raw data, completely de-identified, of course, with the zip code and the positive or negative test results, and had them sort it and figure out which of the zip codes, residence zip codes, that popped up the most frequently, and then look at the positivity rate amongst those those communities. So Maywood was the most represented in our database, and we ended up having about a 9.7% positivity amongst those folks who came in to be tested. Melrose Park was at 17%, and again, Melrose Park is largely Latinx. North Lake, 25% of the individuals from North Lake who came to be tested tested positive. Bellwood 7. And just again, as our reference, our communities to the east, Oak Park and River Forest have documented positivity rates, recent ones, of around 3 to 4%. So stark differences. And hopefully we can, with more testing, it's the key with testing. And so our president has said that, well, the reason we have such high positivity rates is because we test more. And to some degree that is true. But by testing, you're protecting spread, right? Every person that we've talked to who's been positive has almost I think there may have been one that our physician called, and he or she was not particularly eager to self-isolate. But every person has been very concerned about spreading it to family members, workers, co-workers, etc. Obviously, it was a free volunteer test. People came in because they were concerned. Either they'd been exposed or they were just curious and concerned. I will say one of the most, and it's something we don't think about a lot, I think, in reaction to this this pandemic, or maybe people do. I know we have on CERCL, we've come to realize that people can test positive for a long time, even if they're not necessarily infectious any longer. So those fragments of the virus are in there, and they're being picked up by test 3 and 4, 5 weeks down the road, when by all public health CDC measures, they're not likely infectious anymore. However, we have employers who are demanding to see negative tests before they allowed their employees back to work. That is not what the CDC recommends at all. But it is on the Illinois Department of Public Health's website that employers can ask for negative tests. So we had a woman break down in tears after getting a positive test result, because no one in her family had been able to work for the last 4 weeks. And even her daughter was not allowed to go to work because she had a positive test. So there needs to be, I think, and we've talked to IDPH and people at IDPH about trying to modify that wording on their website. But as it stands now, employers in the state of Illinois can ask for negative tests, even we don't think they're infectious, and by all measures are likely not infectious any longer. So there's some really incredible stories, and it's people like that woman and her family that Maya and the Health Justice Project are really helping out through that social support. And so nothing new, as I said, this, nothing happens in isolation. So COVID-19, it really has starkly illustrated these historical inequities that have occurred between our neighboring communities, based on discrimination, healthcare access and utilization, education, income and wealth gaps, housing differences, as well as occupation. And I'm just going to throw these graphics up here looking just, and I like graphics because I think it really illustrates well the differences between these communities. And I've stuck River Forest here in the middle. And this is just a graphical representation of different types of jobs. And I did have, sorry, this is from data.usa. Sorry, when I changed the slide, I forgot my attribution here. But this will show you River Forest has low rates because people can stay home and work. People like me, they have largely professional jobs. In Maywood, it's more of the service occupations, and in Cicero, Melrose, and Berwyn, it largely is construction, manufacturing. These Maywood and Melrose and Cicero and Berwyn and Bellwood, these are what were termed essential occupations from the beginning. These are the people who stock the grocery stores, are cashiers at the grocery stores, drive the buses, drive the metro, clean the healthcare settings, etc. And they are the ones, and we know this from what we read in the newspapers. But for me, it's always striking to have that personal connection to know that this is what is going on in our communities. So I would like to finish because I do love Maywood. I'm happy to live here. It has many, many pluses. We have very, very good folks in my community. And we want to look positively for the future. We have a mayoral election coming up next year, so we always push for change. And I would argue that Maywood and our other communities, really, the door is wide open. And we're making strides, and CERCL, I think, has been a key, one of many. VeggieRx has been huge in connecting Loyola to our surrounding communities, and there have been other projects throughout the years. But I think that it's something that we just need to think about as we move forward, because we're all in this together, and I think that this pandemic is certainly showing that. And so with that, I will leave you. This is my son, so I always like throwing that up there. So with that, I'd be happy to, answer any questions or, engage in conversation.
Great, thanks, Amy. So yeah, so if anyone has any questions, feel free to unmute yourself and please introduce yourself. Let us know if you're at Loyola and where at Loyola or outside of the institution. And yes, so if anyone would like to ask a question.
Hi, Amy. I'm Dawn Franks. I'm with the Loyola MAMS program, Master of Arts in Medical Sciences. I'm on the Lakeshore campus. I put the question in the chat, but I'll ask it too. So I have several graduate students, a few of who are in this talk today, who are trained with Dr. Silva's contact tracing program. One of the things we found is that there weren't really many volunteer, like short-term volunteer, 1 day a week opportunities for contact tracers to do it. Has more or less all of those become full-time jobs now, or?
Well, all right. So first of all, I don't want to throw, I hope if there's anyone from Cook County Department of Public Health here, I don't want to throw them under the bus, but Cook County has been extraordinarily slow in, I don't even want to say ramping up, but getting any contact tracing done. And so I know Chicago actually has better infrastructure. And yes, a lot of it is turned to, in the city of Chicago, they're actually working through community-based organizations a lot. So that might be the one way of, and we could reach out to Dr. Silva as well as some of the MD and PhD students who are working with her on that to see if they have connections. And in fact, I just spoke with yesterday someone who was the chief medical officer at CDPH and has offered to link us to more folks in the city and CDPH, and hopefully regarding contact tracing. So there might be new things moving through the city that we could certainly Yep, and as Joanne says here, their CDPH is hiring 6 contact tracers that may be full-time jobs. And again, so I think that we're in such a dire situation that really full-time jobs are needed, but those in the city working through CBOs or community-based organizations may provide an avenue. So Dawn, if you could just send me a note that after we contact CDPH again, if there's anything, new information that I can pass along, I'd be happy to do that.
Absolutely. Thank you. Thanks for this
Sure.
presentation. Very, very informative.
Amy, I'll go ahead and jump in here. David Van Zijtveld, Director at CERCL. What has the response been from local elected officials, from Cook County, from Maywood to CERCL? I mean, is there sort of what has the response been now that you're kind of up and running in this otherwise just this barren landscape? There wasn't anything. There was this I hesitate to call it overlooking of resources for Maywood and the other 5 communities. What's the response been since?
So first of all, I wouldn't avoid calling it overlooking.
I want to go with something stronger, but
I see. Okay, all right.
It might get a little colorful. So
okay. Actually, it's been phenomenally positive. We've been working from the beginning with the Village of Maywood, and not necessarily the village government piece in Melrose Park, but certainly some very long-standing and nonprofits in Melrose Park. As we've expanded, we now have on board government officials from Berwyn, Cicero departments of health, or their village departments of public health. They still come on, they're not like Oak Park and Skokie. They actually do come under Cook County Department of Public Health. They're working with us actively to identify sites, as well as in Bellwood. So I think it's been tremendously positive. And I will say that the Proviso Township, so I'm not from Illinois, even though I've lived here for 30 plus years. I don't understand the concept of townships. And so David, maybe you can explain that to me. But so it's like an additional layer of government between the village and the county. I don't get it. But that said, we're the 3 of the northern communities, Melrose, Maywood, and Bellwood, are all part of Proviso Township. And their mental health commission has just given us a wad of money to continue or to support the testing in these 3 communities. So our state senator Lightford, she was one of the first people to reach out, and she's written us letters of support. And the Illinois Department of Public Health has been very receptive. Cook County, I think the Department of Public Health is so, they have been so strapped for personnel and funding for decades and decades. So the former chief medical officer of CDPH, whom I spoke of a minute ago, and actually she just left and she's now at the CDC. So, and she said that when she started 20 years ago in the Chicago Department of Public Health, they had 2,500 employees. When she started at CDPH just in February, so she wasn't there very long, but there were 450. So we're talking about, and that's Chicago. Cook County has suffered even more. So public health has been underfunded dramatically. And we've seen that is in the national response to this pandemic. It's completely lacks coordination across every step. So that said, the Illinois Department of Public Health has been receptive to us greatly. I mean, they put our site on their website, as and unfortunately their response was, Well, you guys are covering it in those communities. So, hey, you know, which again, we were volunteer, you know, a little volunteer organization, not appropriate response. Cook County Department of Public Health has been so hampered by not just, you know, human loss or lack of human resources, but lack of funding, but also Cook County has incredibly onerous legalities. And so the process of hiring individuals for anything in Cook County, it can take months and months and months, which is not the type of response something like this requires, right? So they have been less receptive. Let me just say, they have been less receptive than the city and the state, as well as some of the collar counties have been quite receptive.
Other questions?
Come out and visit us on the Health Sciences campus anytime.
Thank you.
Oh, you're welcome. Thank you for having me. Sorry, I was just reading through some of the chats. So maybe I could take a look at those in a bit.
Thank you.
Well, Amy, this has been fantastic. Thank you so much for being with us this morning and presenting. We will have this recording available sometime next week. So just check your email for that. And yeah, thank you so much, and take care, everyone. And we'll see you at the next couple seminars.
Have a great weekend, everyone.
Thanks, Amy.
Thanks.
Thank
Bye-bye.
you.